Thank you for joining us for this episode of PT Talks. I'm Austin Tripp, owner of Advancing Health Physical Therapy, and today we will be talking about post-intensive care syndrome, or PICS, which could be any ICU stay, but for this episode we're going to be specifically looking at COVID-related ICU stays. Greater than 50% of people who have been discharged from an ICU may experience cognitive problems, psychiatric problems, or physical problems. Some of the cognitive problems that may be experienced: loss of memory, encephalopathy, delirium, confusion, even possibly strokes. Some of the psychiatric problems that may be experienced: depression, anxiety, PTSD, or even insomnia. And some of the physical issues that we may see after someone has been discharged, especially from a COVID situation: weakness, decreased mobility, decreased balance, respiratory decline, heart problems, kidney problems, liver problems, and even increased risk of blood clots. The longer that a person is in the ICU, or the more intervention that is required while that person is in the ICU, increases the risks of problems in cognitive, psychiatric, and physical. So what can physical therapy do? Well, first off, the ICU-acquired weakness is one of the main problems after being discharged from an ICU. Patients can start to experience decrease in strength within 4 days of being in an ICU, with up to 10% muscle loss within the first week alone. Physical therapy can provide a customized exercise program for that patient to help that patient meet their physical needs, including increasing their mobility, increasing their balance, increasing their strength, and helping them be able to return back to the level of function that they were previously. The second area that physical therapy can help is in patients with respiratory decline. If a patient's vital signs are not monitored after the ICU, anytime an exercise program is performed, it could be unsafe for that patient. Physical therapy, we can provide intermittent monitoring of that patient, including checking their oxygen, their heart rate, their pulse, and their blood pressure in a safe and healthy environment to make sure that that patient is able to reach their goals in a safe way. And the third thing that physical therapy can do is that statistically, early exercise after discharge in ICU improves that patient's quality of life, ability to return to work, risk of rehospitalization, and also risk of death. If this is something that you're experiencing, if you've just recently gotten out of an ICU, especially due to COVID, or if you have a family member that's having issues with this as well, please reach out to me and see what we can do to help you with these issues. Our phone number is 251-301-0574, and the email address is physicaltherapy@advancinghealthpt.com. Thank you for tuning in to this episode of PT Talks.